Hi, my name's George McMahon. In 1987, my doctors wouldn't release me from the hospital. I had to release myself. At the time, they wrote me a letter that said, George, you're terminally ill. And I said, well, what does that mean? How many days do I have to live? And they said, we can't tell you. We don't think you'll make it home. So my wife came and got me, and I came home. And I started a daily routine of smoking marijuana. I'd been able to smoke marijuana off and on all my life. We knew there was something wrong. I needed to smoke marijuana for 20 years. But nobody would believe me, and doctors would believe me, but didn't know how to help me. After the episode of my health in 1987, which just culminated a lifetime of bad health, they had given up hope. They actually stated that I couldn't even be made comfortable anymore, that they were giving me morphine and the very strongest of painkillers, as well as psychotics, and on and on and on. I could list them, but it would take too long. So to give you an idea, that at one time I took 17 pills a day and was laying in my hospital bed cut right in half. And they told me, you only have a short period of time to live. I called my wife and said, please come get me. I need to come home. Some teenage kids came over to my house and wanted to buy a car, and I was laying on the hospital bed, and my wife was afraid I was dying. I was dying. They said, we'll give you some marijuana for that car that we picked along the road because we know you used to smoke it, and maybe that will help you. Some kids said that to me. I'd been thinking along the same lines too, and I smoked it. And I've been, since that moment, I think since maybe the first day, continually getting better, or at least being comfortable most of the time. And to me, that has improved the quality of my life so much that I'm actually better. And that's impossible. My letter says that I am progressively, advanced terminally ill. There is no, it's a genetic defect, they can't stop it. Since 15 months ago, I began legally smoking marijuana. At this point, I'm holding in my hand a letter that states I'm not only comfortable, the quality of my life is improved to the point that I can get up and walk around, and I can spend time with my friends. I can occasionally go out. I can do it as often as I feel up to it, leave my house and go somewhere. And that's not anything that was optional to me in 1987. I was in a hospital bed and I was dying. I wasn't going to live much longer. What makes me so mad is it's my right, but it's not everybody's right. When I talk to people, from doctors to lawmakers to on and on and on, I get the same attitude. They don't tell me it's wrong. They tell me, God, look at you, it's right. Then how can it be right for me and right for 34 other people, but not right for everybody? It just doesn't make sense. There's people dying. There's people going to prison. There's people whose quality of life has been changed beyond repair because of the regulations against the use of marijuana as medicine. I think probably everybody who would risk 5 years of their lifetime, everything they own, to smoke a cigarette, the only possible reason they would do that is because it's medicine. So at this point, you got to stop and think about it. Would you risk 5 years of your life for anything other than something that was making your life quality of life better? I don't think so. The rules need to be changed. One of the things that's been discussed is the types of ailments that would use marijuana, or the types of things that would be wrong with people. And everybody kind of thinks, well, I'm a specific group, and in reality, we're all in one group, because the types, my protocol is for pain and spasm and nausea. Those three things are the three major things that the chemo patient has, that the AIDS patient has, that the MS patient has. The chemo patient has intense nausea, life-threatening nausea when he has chemotherapy, and at approximately 30% of the time while he is in chemotherapy. The AIDS patient needs appetite help because of his nausea, and that's also why my protocol was written. That's part of my problem, is that you have nausea, you don't want to eat. The pain part comes from a lot of body damage, cut nerves, muscle damage, which also pertains a lot to the muscle spasms that I have. Also the problem that I have back injuries that cause spasms in my legs. That puts me into the same category as, for instance, the MS patients. So we have a whole lot of groups of people who can use marijuana. For instance, another one is people with migraine headaches, you know. So you have this whole large group, but they're all different. But all of us are like in that we have major illness, and it isn't something that goes away tomorrow. So if you include all of these things, pretty much we're all one big group. We're not each individual group. The AIDS patients, the MS patients, the people who have some orphan thing like I do that are just one or two of me in the United States maybe, are not one or two of me in the United States. All of the people are my peers. You know, I have some of the same things going on that almost all of them do. So I would say that basically that puts us all in the same group. And they seem to interspace with each other. You know, nausea is not just a patient problem for AIDS and MS patients. It's a big problem for anybody that's taken toxic medication. You know, and we can go on and on and on and tie all of these things together by just maybe the slightest thread. But if you're sick, you're sick. And you need to do something about it, and it's not go to prison, and it's not feel bad about medicating. Those things are wrong.
I'm Terry, and I have multiple sclerosis. I was diagnosed in '87, and it's chronic progressive.
Why don't you show us what it looks like before you medicate, how you're...
I shake like that until I have my medicine. And once I have a dosage, I can move my legs and my hands don't hardly shake at all.
You mentioned medicine. What kind of medicine is it that you're referring to?
Marijuana.
Your condition?
I think this is the best medication a person could get. I think they're depriving the benefits from a lot of people.